Hello, this is Dr. Jablecki. I'm presenting some information about COVID-19 so that you get the most factual data. First of all, a little bit about disease. Diseases are classified a number of ways, one of which is by the host organism. So some diseases are transmitted solely from humans to humans. Some diseases are transmitted from animals to animals. And then some diseases are transmitted from animals to humans and vice versa. And that's what COVID-19 is, a zoonotic disease. So these diseases, whatever they may be, have to go through a disease cycle. The first thing we want to talk about is, in this case, we're going to talk about the disease cycle for a coronavirus, for which COVID-19 is. The reservoir for the coronavirus is humans and animals, primarily the bat and humans. The way it leaves the current infected animal is through a cough or sneeze from the lungs. Air is the mode of transfer. That's how it gets from one organism to another. We're going to talk about another disease classification in just a minute, and that's the portal of entry. All diseases are also classified by their portal of entry. For coronavirus, the portal of entry is through inhaling into the lungs. And for our concern, the susceptible host is the human being. So I said that there's some other classifications, and that's by portal of entry, one of which is respiratory or airborne pathogen. Another is gastrointestinal, foodborne pathogens, waterborne pathogens. Another is the bloodborne pathogens like HIV and some others. One is through interuterine or transplacental, in other words, from mother to baby. Some, very few, from urinary tract. And last but not least are arthropod-borne diseases. Now, there are some diseases, very few, that can actually be transmitted by saliva, and that would be, cold sores, herpes, things of that nature. So we're going to talk about respiratory, that portal of entry. As you can see, there's an awful lot of respiratory infectious diseases, and the thing in common with all of these is the way they get transmitted is they're expelled from the lungs of an animal, transmitted through the air, and then inhaled by the host animal. And anthrax, can be as brucellosis too, can be weaponized as biowarfare organisms, and then they don't actually come out of a human, but they're disseminated by weapons to infect others. So back to the coronavirus, that's what we're talking about. So currently there are 7 named coronaviruses that infect human beings. The first 4 are different variations of the common cold. And then we have MERS, which came about around the early 90s, SARS around 2005, and SARS-CoV-2, which is COVID-19. Now, it is a respiratory disease, so you can't get it from your hands. You could probably eat a bunch of it and you wouldn't get it. You can't get it from drinking something. You can't get it from a skin puncture. You can't get it from a mosquito bite, and you can't get it from touching stuff. You get it from breathing. That's it. That's how you get it. Another thing you need to know is UV light kills the virus very, very fast. So when you're outside in the sunlight, I don't think you need to worry about getting it. Now here are some factors about COVID-19 versus some of the other coronaviruses. So the common cold There are way more cases of that every year worldwide than any of these others. But hardly anybody dies from it. Some do, but very few, making the case fatality rate extremely low. Now, MERS, on the other hand, not very many cases, but a huge number of deaths, making the case fatality rate very high. SARS is similar. That's a pretty high case fatality rate, but again, very few cases per year. Now, COVID-19, uh, this is the projection for 2020. That's the projection of deaths for 2020, and that's the projection case fatality rate. Note that it's far less dangerous than these other ones that we didn't do any personal protection or social distancing or any of that mumbo jumbo. Now, some more information just depicted in another way. There's cases per year, far more common cold than COVID. Uh, Deaths per year, looks like COVID-19's the main one right now, 2020 projections. And the case fatality rate, COVID-19's not all that bad. So, deaths projected from various diseases in 2020. Note that the first four diseases are airborne transmission, respiratory diseases, and the top three are not COVID-19. Tuberculosis is going to kill about 4 million people in 2020, pneumonia about 3 million, and COVID-19 about 500,000. So let's talk about the mask. Everybody's wearing a mask. A lot of governors and mayors say you got to wear a mask. Well, the mask will help prevent an infected person from transmitting the disease to another susceptible host. But that only works if the person wearing the mask is, in fact, sick from COVID-19 and shedding the virus. Otherwise, wearing the mask is pretty much worthless. So, will the mask protect you, the wearer? There are a lot of people think it does. Yeah, I'm putting this mask on and I'm protecting myself. At least a little bit I am. No, I don't think so. Other than an airline respirator, the N95 mask is in fact the best mask you can get. But it was created specifically to protect healthcare workers from tuberculosis. But they soon learned that it didn't protect the people as well as putting the mask on the infected patient. So that if the infected patient wore the mask, it was far more likely to protect the healthcare worker. Now, what does N95 mean? Well, the N stands for not resistant to oil. I can't, why that's important, I'm not sure. And the 95 means that it will keep 95% of the tuberculosis bacillus from getting through the mask. And those mask pores are 0.3 microns in diameter. So, it does work quite well for tuberculosis because they're 0.2 to 0.5 microns in diameter. But the viruses, all viruses, are much, much smaller. And even though the coronavirus is considered a very large virus at about 0.1.5, it can easily go through the mask. And as you see in this drawing here, the TB bacillus is far larger than the COVID-19 virus. The pore size of the mask being 0.3, and you can see that those little red viruses can easily go through there. Now, where in the heck did this 6 feet come from? What's so magic about 6 feet? And just so you know, the World Health Organization only recommends 3 feet. And their 3 feet came from a 1940s tuberculosis study in which they found that if you're 3 feet away or more from the infected patient, your risk of contracting disease is far less. But the 6 feet, here's what that happened. In 1918, the Spanish flu, when it first came about, A country doctor in Kansas, nearby Fort Riley, a soldier came in and he was ill, and the doctor knew he had influenza, a pretty severe case of influenza. And before noon that day, another 100 soldiers had come into his clinic with the same symptoms. So that was the onset of the Spanish flu, which was a global pandemic. And the Army, in their effort to curtail the spread of that disease, put out a directive to the field commanders that all soldiers would sleep head to foot and that the sleeping quarters would maintain at least a full cot distance. And a full cot distance is 6 feet. So there you go. That's kind of where it came from. So you hear this all the time. We are in this together. Well, we're not. And here's why. There's a lot of countries in the world with a huge population of 7.5 billion people. Some countries have gone overboard on this protection thing, and the United States is maybe the most stringent of all the countries in terms of government mandates. Although some states are stronger or more stringent than other states, some cities are stronger, more stringent than others, but overall, the United States has a really, really strong government influence over what they consider to be how to keep this disease from spreading. Then there's some countries, Sweden, Indonesia, that have no government mandates. They don't mandate that you wear a mask or stay 6 feet. They let their people do what they want. And the rest of the world is somewhere in between those. Now here is what I find very, very interesting. The data you see is as of June the 8th, so it's right now. And the world cases versus U.S. cases, the United States has nearly a third of all the identified world cases, and pretty much the same for total death. The United States has a third of all the total death in the United States also. Feet. Well, a lot of it probably came from all the CDC's and Dr. Fauci's information that was put out about how the disease is transmitted. Well, as of late, the CDC has been correcting themselves, and they've been putting out the truth. And why, I don't know, but I think it's great. So first of all, they do admit the mask offers little protection, and pretty much only if the sick person wears it. They say you're pretty safe out in the sunlight. They say that UV light kills the organism once it's expelled in a matter of seconds. They say social distancing is of little benefit, and that makes tremendous sense since, you're standing in line 6 feet behind somebody in a grocery store to check out, and then you move up right into their air. I mean, that air around them didn't go with them when they moved up 6 feet. They also say there's no need to do all this sanitizing and wiping down surfaces because you can't get it from a surface into your lungs. Also, in the restaurants, there's no need to keep all those condiments away from the table. It doesn't, and use all those plastic and paper utensils. You don't get it from eating it. And last but not least, and I think this is great, they are admitting that it appears immunity is afforded to those that have recovered from the illness. So a few final comments for you. This is not the first virus outbreak the world has experienced. We've had many of them in the past, and yet this is the first virus outbreak that the United States has instituted drastic, unrealistic, and unneeded control over its citizens. The answer to all of this, in other words, these virus outbreaks, has been, is, and always will be herd immunity. That's what works. So this is my prediction, because of what the United States has done and delaying the natural process of herd immunity to occur, in November, the United States will see cases rise again. but not in Sweden. Notice that rhyme again, Sweden, again, Sweden. Nice. So I want to thank you for your time. I hope this has been a help, and please don't be scared.